Hello, everyone. I'm Natalie Kunzman, MD, and today I think we need to talk about the overtreatment of viruses. I think a lot of this is born from the past 2 years of nervousness and anxiety and some hysteria associated with the novel virus that is circulating and mutating in the environment. But I have to warn you that we are surrounded by microbes, virion, parasites, and a whole host of environmental irritants and allergens. So we are bombarded every single day in our human existence. I have a side job that I do some acute care work in the summer times at a resort town. And what I'm observing is something that I'm going to share with you so that you can become a good, sophisticated, well-educated patient while we can become a good provider, physician, and educated along the way as well. So what do I mean by this? Well, what I am seeing is a hysteria and an anxiety within the first few hours or day of symptom complex and then immediately seeking medical attention. So we can run into a lot of problems by doing this, and some of that revolves around the diagnostic arm of what we're trying to treat in the first place. So within the first few hours of an illness, and especially where a virus is concerned, we have something that's called prodromal or the prodrome phase. That might be the first few days of just simply being fatigued, needing to sleep a little bit more, being slowed down, being a little bit cranky, appetite going down, and that's most people's warning sign that the immune system is activated. If you seek healthcare within that window of time, you may not know what you're dealing with, but also your provider may not know what you're dealing with because so many conditions will mimic that prodromal phase. And I have to give you fair warning, even testing that is available may not be able to pick up what you are concerned about within those first few hours or day. So that could also mean that you get some false negative results as your virus or maybe even bacteria is starting to reproduce and multiply. And if it's not in a high enough of a load, it may not be able to be picked up. Okay, so again, there are so many different conditions out there, and yet when it comes to viruses, there is not a test for every single virus that exists. And wouldn't that be a great thing if we had it? But currently it would be cost prohibitive and it is just simply not available. So presenting too soon may not pick up the true condition in the first place. Secondly, if your provider is feeling a lot of pressure to make you feel better or to attack the problem, there might be some pressure of over-medicating. And this has been my biggest concern because an antibiotic does not take care of viral conditions. So we have to start there. Don't get me wrong. You may be presenting with a bacterial infection, but you typically aren't presenting with that within hours. That takes days until the immune system is rendered to the point where we can actually identify it. Now, some of the symptoms of upper respiratory virus is a runny nose and congestion and a scratchy throat and a cough, but many times that mucus is clear and maybe a little thickened. And the bacterial phase may take a while because the normal bacteria that will live in the sinus cavity that are living there commensal at all times may feed on that mucus, which is a mucopolysaccharide. And after they've been feeding for a while, they can reproduce and multiply. And I've always been taught that the color of mucus when it is green or yellow, or maybe even brownish in discoloration, is the byproducts of bacteria as they are dying off and they luminesce somewhat like a firefly. And then of course we've got fungal issues that might be dark brown and black, but that's a topic for another day. So again, you don't really want to be taking antibiotics for a virus in which it won't work, because now you may add in allergies, you may add in a side effect profile, and you're really going after something that doesn't exist, but you may be at the risk of killing out gut bacteria and good healthy bacteria in the process. Now, there are a few antivirals that can specifically attack the herpetic family, such as herpes zoster, and we may actually be able to go after herpes simplex, but we can't yet have availability to treat mononucleosis. And when it comes to the current pandemic virus, we only have one that is used for emergency use. And again, I have been cautious against emergency use authorization. And in this particular one, the side effect profile is substantial, and with it comes the need to monitor liver and kidney function. So that is no small feat. And in other words, you don't want to just simply be giving out an antiviral within the first few hours of something, whether you know or don't know what something is, especially if you are a low-risk person with a normal, intact immune system. So if I can say one thing, be a good patient, take some time to listen to your symptoms. In a virus's world, sometimes you will get over these symptoms in 3 or 4 days. So you certainly have the luxury to wait 1, 2, or 3 days and see where this is going. And the catastrophes of the current virus and the pandemic don't happen to normal intact immune systems within the first few days. They happen to vulnerable people that have a compromised immune system and an inability to fight in the second phase once they are hitting the cytokine storm and some of the inflammatory cascade that has happened from that particular virus. So take a little time, assess your symptoms. You certainly can be calm under these conditions and vigorously hydrate. Do what your body is telling to tell you to sleep. This might be the time to ramp up some vitamins and vitamin C and vitamin D and quercetin and potentially vitamin A and zinc. All these things are to optimize the host. They may not necessarily be an antiviral, but they will optimize your host to promote healing and to promote your immune system to get the job done in an expedient fashion. Again, you know when to find us providers. We are certainly here for you, but we are going to do a much better job for you if we have a few days for you to assess your symptoms, give us a good picture, and see where this illness is taking you. Or if you are fortunate, like the average human being with a good intact immune system, you'll get over it without us. Again, I am Natalie Kunzman, MD, and you can find me online at nataliekunzmanmd.com.